Would you trust an AI chatbot with your mental health issues? Maybe, if you needed help but couldn't find a therapist. Worldwide, 1 in 8 people struggle with mental health issues, and young people are especially vulnerable. But therapy is hard to come by and can be costly. AI chatbots trained for therapy are designed to help, but can they? A market overview. There are thousands of mental well-being apps on offer. Many of these come with chatbots for one-on-one counseling. The chatbots are meant to help users with mental health issues by answering questions, offering guidance, or providing advice. Some are privately owned, like Diana from Mexico or Say Hey from India. Others are government initiatives, like Pakistan's Amras. This website here claims its AI can impersonate anyone. And between AI versions of Albert Einstein, the GigaChat meme and Elon Musk, there's an AI therapist. It was created by a med student. He fed it the basics of his psychology studies and then used it to vent about his exam stress. But after others discovered the bot, it became very popular. Today it sent out nearly 95 million messages to its users. So, what are the perks of an AI therapist? Here are 3. Number 1. Availability. An AI therapist is available anytime, anywhere. If you're having a panic attack at 2 a.m., it's right there to calm you down. Second, accessibility. For meeting your therapist, you need to get dressed, leave the house and commute. That can be a lot to manage if you're dealing with mental health issues. AI chatbots let you choose the time and place for your sessions. Third, personalization. An AI companion could be programmed to behave exactly as you need. Sometimes the relationship between a therapist and a patient can be tricky. If they're not in sync, therapy becomes a lot less effective. What I find really interesting, a study showed that amongst minority groups, people's willingness to seek help increased significantly when a chatbot was available. In the study, referrals for mental health services increased by 29% amongst ethnic minorities and 197% amongst non-binary people when a chatbot was used in the referral process. So, individuals in these minority groups may find it easier to open up to a chatbot, free from the fear of judgment or prejudice. But there are downsides. AI makes mistakes, and in this context, they could be life-threatening. In a 2022 test of the therapy app Wobot, it responded to a user's plea, "I want to jump off a cliff," with, "It's so wonderful that you are taking care of both your mental and physical health." Of course, most AI models have safety guards, but we've seen them fail quite often. So, who's responsible if the AI makes a mistake? Human therapists need years of training and must abide by strict laws to offer their services. As for AI, no one really knows how these models have been trained, and some apps market themselves as mental well-being apps to evade the regulations that come with offering mental health services. And when it comes to our health, privacy and data security are especially important. Research by Mozilla found that 19 out of 32 popular mental health apps were failing to protect users' privacy, meaning they did track and save users' private information, and some shared this with advertisers. So, what does science say? Studies have shown AI companions can indeed deliver a form of therapy to help with mild mental health issues. However, as the authors of all those studies stress, they cannot replace human therapy. Remember when we said if therapist and patient are not in sync, therapy isn't effective? Well, if they are in sync, human therapy proves to be far more effective than chatbots. Human therapists excel at picking up subtle nuances and hidden signs that an AI may miss. Yet, AI can play a crucial role in filling gaps in mental health services. It could help bridge long waiting times and even complement human therapy, acting as support between sessions. I think it's an interesting approach. What do you think? Let us know.